Hi, everyone. For those of you who don't know, my name is Autumn Sipis. I am the Marketing and Outreach Coordinator with the Canadian Coalition for Green Healthcare. On behalf of the Coalition, Peach Health Ontario, Nourish, and Cascades, I would like to welcome you all to today's webinar, Planetary Health Menus, Implementing Plant-Rich Diets for People and the Planet. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of our webinar today. We will also be recording this webinar, which will be sent to all registrants and will be available on the website / our YouTube channel at a later time. I'll now hand things off to Miles Sargent, the Partnerships Lead for Peach Health Ontario, and as of tomorrow, the new Executive Director of the Canadian Coalition for Green Healthcare. All right, Miles, you can take it away.
Okay, thank you very much, Autumn, and welcome everybody. Important topic today. First, I want to say thanks to Autumn for that introduction. And the other important people to thank are the sponsors of today's talk, and that includes University of British Columbia, Peach Health Ontario, Nourish, Canadian Coalition of Green Healthcare, and Cascades. So thank you, everybody, for supporting this talk today. And the other thing I want to say is thanks to Neil Ritchie, who is on his final day today. We had his final coalition meeting this morning, and we're all sad to see him step down, but also happy for him stepping into retirement. Neil was the executive director of the Canadian Coalition for over 3 years, and he brought experience from a hospital leadership perspective. He'd been CEO roles in various places in Canada over the years and helped to build partnerships with hospitals and grow our membership base. He co-developed leadership guides for hospitals and long-term care, which you can find on the websites, and also started to develop the Sustainability Champions program and making links with industry. Personally, it's been absolutely a pleasure to get to know Neil. For me, it's just been over a year, and I've told him that he's not going anywhere. We hope to keep him on in some capacity. And one thing important to note is that Neil was a key proponent of the Common Roots Urban Farm Program in Nova Scotia, which is a hospital-based vegetable farm program, which he helped to start. So nice that we have this topic today. And yeah, food is important. Food is medicine. And as I'm sure many of you are aware, Canada's Food Guide made some significant changes a few years ago. And if you've not looked at that, I encourage you to do so. We met the 2 students last summer and discussed all the possible projects that they could do, both of them from a nursing background, doing their master's at UBC. And they wanted to do food, and we focused on plant-rich diets. Specifically, what they were looking at were plant-rich diets at health facilities in Ontario, and really how successful sites were in implementing plant-rich diets. So I'm going to get to introducing the 2 students and then let them take it away. The second half of our talk, I should mention, will be with Hayley and Marianne talking about how we can actually implement these ideas in healthcare. So first, Elísabet Brynjarsdóttir is an Icelandic nurse who just finished her graduate degree, Masters of Health Leadership and Policy from the University of British Columbia. She resides in Reykjavik and works with the field of climate and health as an environmental and health officer. She teaches at the School of Nursing at the University of Iceland and works remotely at Simon Fraser University and Providence Health as a research assistant for Dr. Angela Rusalilo. Elizabeth's interests and focus throughout her years as a nurse have been social determinants of health, health equity, and equal access for all to health services, sustainability, and climate justice. She worked as the project lead for the Icelandic Red Cross, organizing harm reduction services for vulnerable and marginalized populations prior to moving to BC in 2021. And we also have Lindi Close, who's been working on the front lines as an NICU nurse for 6 years. Lindi recently transitioned her career to focus on planetary health as her personal and professional concerns about the climate crisis intersected. And she recognized that public health is dependent on how we approach the climate crisis. Lindi has completed her master's degree in health leadership and policy at UBC, and throughout that program, she became more passionate about food systems and healthcare and the power and responsibility that healthcare has to support patients and the planet through food. So here we go, handing it over to Elísabet and Lindi.
Thanks. I think I'll just wait for Autumn to give me control of the screen. Maybe I have it. Okay. Okay, hello everyone. Thank you so much for being here. Miles and Autumn gave us a quick little introduction. So as you know, we're both graduates of the UBC program, and we're here to talk about the work we did with Peach and Nourish as part of our practicum. So, sorry, I want to just go back one here. Oops. Oh, it's going the wrong way. Okay, so before we continue, Elísabet and I just worked on this land acknowledgement. We just want to acknowledge that the work we've done has taken place on the traditional lands of the Musqueam, Squamish, Coast Salish, Tsleil-Waututh nations in what is known as British Columbia. And we collaborated a lot with those living on the lands of what is known as Ontario, including the traditional areas of the Anishinaabe, Iroquois, Huron-Wendat, Mississaugas of the Credit River, as well as the 6 nations of the Grand River. And we know that we can't fight the climate crisis and really truly embody planetary health, which is the pursuit of both the health of the planet and our people, without Indigenous knowledge systems and the individuals who possess and share that knowledge, as planetary health is really rooted in Indigenous knowledge. We've also learned through this work that culturally appropriate food can aid in restoring and respecting the relationships that Indigenous people have with the land, with ancestors, with current and future generations, and with local environments. The work we continue to pursue in sustainable healthcare, particularly food systems, needs to be rooted in decolonizing these systems and advancing the work of reconciliation, and something that we'll touch on a little bit later in this presentation. So yeah, I'll just skip through this really quick. Miles gave us a great introduction. Originally, our project started with Peach, a charity that forms partnerships across healthcare facilities in Ontario to engage in climate action. And then we joined forces with Nourish. We'll hear from Hayley from Nourish later, a charitable organization that supports healthcare and leveraging the power of food to address climate leadership. And we'll zip through that because you already know us. So this is just a quick background of what our webinar will look like. And I think I'm handing it off to Elísabet. Is that true?
Yes, thank you, Lindi. Throughout our work, we've definitely felt paradoxical feelings. The health sector plays a central role in responding to the climate crisis, while it's also contributing to about 5% of the global greenhouse gas emissions, and it's growing. We've also seen that healthcare professionals understand the seriousness of the issue. We've attended lectures and noticed a momentum building within healthcare to address climate risks, protect vulnerable populations, and advance the quality of health. So before we dive into our results of the survey, we want to be clear in our terminology and establish a shared understanding so everyone can enjoy the webinar. Next slide, please. Yes, thank you. How does climate change connect to health? First of all, there are certain gases that cause a greenhouse effect, allowing the sun's rays to pass through and warm the planet, but preventing warmth from escaping. So that results in a change in our climate. They are known as greenhouse gases. Human activities have disrupted a stable greenhouse gas supply on Earth, causing our climate to change at a faster speed. And secondly, healthcare does play a part. In Canada, the healthcare system alone produces about 4.6% of annual greenhouse gas emissions in Canada, without accounting for anesthetic gas emissions. And more notably, 71% of healthcare emissions stem from the supply chain. Here we have an
Right, that wasn't me. There you go.
Yes, there we go. And here we have an overview from Project Drawdown of how the global greenhouse gas emissions are distributed. And we want to especially highlight that food, agriculture, and land use account for about 24% of the emissions. And then the next slide, please. This is another graphic from Project Drawdown that shows us that there's a wide range of interventions for reducing greenhouse gas emissions within hospital organizations and operations. The most impactful step, as we see here, is addressing waste and plant-rich diets. So healthcare facilities such as hospitals and long-term care facilities can use their significant purchasing power and reputation to advance climate leadership and bring to life Canada's food guide, including serving less meat, sourcing more sustainable meat, and incorporating plant-forward options. The modeling of planetary health diets by healthcare facilities, the optimal sustainable diet for people and planet, will contribute to a population dietary shift, which can generate co-benefits from reduced risk of disease, healthcare costs, and reduced greenhouse gas emissions. So like we can see here in this chart, the greenhouse gases contribution by food type, we have about 56.6% from meats and then 18.3% from dairy. But this doesn't mean that we're suggesting that that should be cut out entirely. And we will see that more in our lecture later on, that it's all about the small steps that we can take. So the next slide, please. All of this brings us to Planetary Health Menus. Through our practicum, we've learned a lot from all of our different mentors and collaborators. And one of our most recent learning is something called Planetary Health Menus. Thank you, Hayley. But Hayley will probably talk more about that later today. But we've come to understand that our planetary boundaries are linked to our health boundaries. And by focusing on public health from a planetary lens, we can succeed. And we, Lindi and I have found 3 ways that throughout all the literature research, 3 ways that we can focus on. And it's incorporating more plant-based foods into our diets, it's reducing food waste, and it's to eat local and in season. Healthcare does not only play a part in climate change, but it will also play a huge part in dealing with consequences of changing climate as we are serving all the populations. So we've looked around the world and we found a lot of examples of initiatives around this sphere. The most recent one we learned about was from New York. So New York City is actually making major changes to menus at 11 public hospitals, offering culturally diverse plant-based meals as their primary options to patients. And we just want to include that as a source of inspiration, hopefully. Yes, I'm handing it back to Lindi now.
Okay, so I just want to thank our colleagues at Nourish for bringing to our attention all the great resources at our disposal to learn about Indigenous food. And I'm going to try my best to kind of give a little background on that right now. So when we consider healthcare food systems within the context of colonialism and reconciliation, it's really vital that healthcare institutions offer culturally relevant foods for Indigenous patients. Traditional Indigenous food systems include hunting, fishing, cultivating, and harvesting wild game and country foods. So these foods can include caribou, rabbit, or berries, for example. Many healthcare institutions have yet to recognize the link between wild game and country foods and Indigenous health. There are barriers to providing culturally inclusive foods for Indigenous patients, and this includes legislation. So for example, hunting regulations don't allow for wild game to be sold, it can only be donated. We have facilities that can't process wild meat or staff developing menus who are unfamiliar with traditional Indigenous food, as well as policies within healthcare that strengthen the power imbalances because they're based on Western science and not developed in consultation with Indigenous communities. And this just maintains common misconceptions around traditional foods, such as that they are, quote, unsafe. So given these legislative barriers, there is really a need for healthcare institutions to develop community partnerships and to support work towards Indigenous food sovereignty, which recognizes solutions based in Indigenous communities, practices, knowledges, and beliefs to restore their cultural relationship with food. And so here we have a few ways that we can start this path to reconciliation with food. Healthcare needs to integrate Indigenous perspectives with Western perspectives by designing menus with Indigenous communities. We want to engage with elders and knowledge keepers to reflect the diversity and needs of that patient population. We need to develop legislation and policies that navigate the existing barriers to wild game. And also we need to educate healthcare staff about Indigenous food to equip healthcare professionals to better understand the complex relationships between Indigenous food, reconciliation, healing, and healthcare. And back to my friend.
Thank you. The Sustainable Healthcare Food team at Peach is currently working on a project in partnership with Nourish Leadership and the Canadian Coalition for Green Healthcare, and we're aiming to introduce plant-rich menus to healthcare facilities across Ontario and hopefully nationally. We will now focus on the methods of our practicum project done for our master's degree. We will quickly go over the results of our survey that we sent out. We arrived at the conclusion for our practicum that the first logical step to kind of grasp what we're dealing with here is to gather evidence through an informal survey. So what are the current practices regarding plant-rich menus and food waste? What are some of the barriers? And we also wanted to showcase the existing plant-rich initiatives. So we developed an informal survey that Peach representatives and Nourish representatives sent out to their partners across Ontario, and it was sent via email to both hospitals and long-term care homes. Following the survey, we conducted a literature review of existing food waste practices around the globe. And then we did 2 interviews for more rich data, like qualitative data, but we won't cover the results of the interviews as we actually have Marianne here in person today to tell you all about their wonderful work at Hamilton. So we will, yes, go over the survey and literature review today, and begin with the survey that we sent out. Here we can see the demographics of the respondents. So 205, sorry, my phone just rang. That's not an emergency. 205 people received the survey. With 27 responding, representing 37 hospitals and long-term care homes. Those who answered cater to over 9,500 beds every day, approximately 2,500 beds in long-term care homes and 7,000 beds in hospitals. And now I will pass it back to Lindi.
Yeah, so next we'll talk about the results in detail. So overall, those who responded really wanted to continue the conversation of sustainable menus and food waste management when asked if they'd be interested on engaging further in this topic. Some were unable to fully answer questions and cited various barriers, including the ongoing human HR crisis we're facing in healthcare, pandemic-related issues, and a lack of organizational buy-in. And there are also additional complexities when approaching long-term care menus. The demographics of these patient populations can really play a role in the uptake of sustainability efforts, particularly surrounding plant-based menus. Starting off, we wanted to gauge if respondents were familiar with the plant-forward recommendations of the revamped Canada's Food Guide, and also sort of use this as an opportunity to give them a gentle nudge to indicate that there are national guidelines encouraging the consumption of a variety of plant-based foods to maintain health. So the survey results indicate that about half of respondents have adjusted to the new food guide, with varying rates of meals that meet the new recommendations. And interestingly, we learned from respondents working in long-term care in Ontario that long-term care centers are governed by the Long-Term Care Act, which actually doesn't require adherence to Canada's Food Guide. And with this population, there's also a heavier emphasis on giving residents more choice to eat food that they're comfortable with to encourage nutrition, as opposed to risking the refusal of food. And you can see from some of the examples that some facilities made changes, including adjusting fruit and vegetable portions, offering more beans, legumes, whole grains, and vegetarian options, and less meals centered around meat. And one thing we really loved about this was we learned that the new food guide recommends people eating together, and one facility provided additional resources to their residents to enable them to eat in a dining room setting. As we dove further into menu-based questions, we asked whether or not facilities had existing plant-rich, so that's vegan, vegetarian, and or traditionally sourced Indigenous meal options, and whether or not any of those options were first choice on their menu by default. So that is that residents or patients are served these meals automatically rather than having to request the options. And from these charts, we can see that a majority of the facilities did have existing options and that some of these are in fact a first choice. A few things became pretty clear while we were reading our responses. One was to be very careful how you word the questions. The initial question we asked about plant-rich options was misinterpreted a few times and thus affected our response rate. So you can see the really large other category here. And that more education is needed surrounding traditionally sourced Indigenous food, how it can be incorporated into culturally sensitive menus, and really why that's important. So here we have data indicating specific menu options by categories of vegetarian, vegan, and traditional Indigenous meals. So we can see that most plant-rich options were vegetarian meals, with over half of respondents serving vegetarian meals 3 to 5 times per week. Vegan meals were less common, with only 14% of respondents serving a vegan option 3 times or more per week. But we do see about a third of them offer vegan meals at least once a week. And it was actually noted interestingly that vegan and vegetarian options in some facilities had to be a special request if a patient was vegan, or for in some cases, they were only part of the heart health menu and not the standard diet. And in the bottom corner, we can see traditionally sourced Indigenous meals were very rare or even unheard of. And many respondents actually reached out to us and wanted to learn more about this topic. We also wanted to gather insight into the current food waste practices of the facilities we surveyed. And encouragingly, the overwhelming response was that most facilities were trying to tackle these food waste problems. Popular responses we had were they're conducting food waste audits, tracking overproduction, or using forecasting tools such as a popularity index to try and craft menus that have a good uptake by patients, which decreases wasted food. Another option that stops waste by reducing production was room service models, including a model that ensures that nothing is automatically added to a tray, such as bread, coffee, or condiments, to reduce waste. And some facilities are reusing food when possible by composting, dehydrating, or freezing it to use in other recipes, or saving food that will be safe to use the next day, all according to their hospital policy. Another was eliminating disposable items, such as clam-style packaging or straws, using biodegradable utensils, or using dishware whenever possible. We also learned about cold-plated or rethermed tray service models, or using warming ovens that can hold trays at optimal temperatures for a set amount of time. And this can reduce food waste due to missed meals. And one exciting response we heard was about a food management fundamentals program that teaches culinary staff how to maximize yields during food prep process and minimize pre-consumer waste. And we also learned about some facilities trying to separate waste streams, although this is a difficult task because healthcare facilities often have external parties doing waste management. And following this survey, as Elizabeth said, we did a literature review, and this was really exciting for us because we learned so much about food waste practices within the context of healthcare. Unfortunately, there is more research needed in this area in terms of food waste solutions post-consumption, as well as the environmental impacts of those solutions. Most research is focused on decreasing food waste before it gets to the patient, although this is the preferred method as it emphasizes using less food and using food more impactfully. The majority of studies we included in this review were conducted with the aim of improving patients' nutritional status, with waste measurement measured as a surrogate outcome of food intake. And next we have the food waste hierarchy. So you can see that hospitals need to consider the food recovery hierarchy when addressing food and food-related waste. So avoiding waste in the first place, using evidence-based strategies, and simultaneously diverting waste from landfills using the most preferred strategies wherever possible will enhance your sustainability efforts. Reusing food is the most preferred strategy in the recovery hierarchy here for dealing with food that cannot be avoided pre-consumption. And there are a lot of regulations and legislations that are presenting big barriers, which must be overcome before reusing food within a hospital is possible. Most studies that we reviewed indicated that choosing food service models that decreased food waste pre-consumption were the most effective solutions, although there were inconsistencies in which food delivery model, so which type of room service model specifically, reduces the most food waste. The most effective strategies overall provided patient choice and also reduced time between ordering and eating. And noted frequently was the importance of raising awareness of measuring and monitoring food waste amongst relevant food service partners to promote action. Composting was identified among the least common practices because really there's just a lack of baseline data to compare the benefits of methods such as incineration versus composting versus recycling. We even read about worm farms and biodigesters versus reusing food waste for new recipes. There are also a lot of logistical and financial issues. So really the bottom line here is that more research is needed to determine the cost and benefits of composting at healthcare facilities and the best methods to do so.
Okay, everyone. Yes, sorry.
No, go ahead.
I hope everyone's still with us. This is a lot of information that we gathered over a period of 4 or 5 months. But in short, we learned a lot, and Lindi and I developed 3 actionable steps based on all the resources we've gathered. So hopefully we can summarize everything we've just said in these 3 steps. It was kind of our way to try and encourage change, because it can feel overwhelming if you don't know where to start. And if you've already started, it's easy to go deep. After a long dialogue between the 2 of us, it came down to simplicity. Keep it simple and know where and how to start. And step number 1 is engagement. So engage with all the different interested parties around you that are a part of the supply chain, colleagues in food services. Find other passionate people around you who want to help. There are dietitians, food service coordinators, procurement specialists, and there are frontline staff who understand the connection between food and health with their patients. Who are the interested parties? How does our supply chain interact with our organization? What are the external factors and internal factors? And we can all inspire change. We're both frontline staffers before entering our masters and still are. And just at the front lines, we can inspire change. And that leads us to the next step, which is to start small. And this is where you kind of can identify the opportunities for simple changes. Like, what is the low-hanging fruit? Is more education needed? Do we need to establish a shared understanding of why we're doing things? Or can we simply just stop using the styrofoam cups at the water machine if we're still using them? And finally, step number 3, don't be afraid to seek feedback. Collaborate with everyone around you. What is the patient feedback of the small changes you're introducing? What is the staff feedback? What's working? What's not working? Are these changes scalable for widespread implementation? Or do we need to go back to the drawing board? Whether or not it's a success, are there any lessons that were learned? So our conclusion in 1 sentence is that now is the best time for change, because a year ago, people had no idea what I was going on about when I was talking about food and the planet. So now's the time. We have some resources at the back, but we won't go over them. I think that's it for us.
Okay, can you guys hear me? Excellent.
Yes.
Well, thank you both. As you know, it was absolutely a pleasure working with both of you last fall. I think you worked very hard. I think we had a lot of fun as a group, and you came up with some excellent results. And as I said to you offline, I expect you both got an A+. You never got back to me on that, but I hope you did. And so just like Neil, we told Neil Ritchie this morning, once you join the coalition, you can never leave. So we'll look forward to working with you in the future. My super quick summary of what you found is that there are some sites moving forward with plant-rich menus, but there is a ton more to be done. You did mention Project Drawdown. I want to bring a little attention to that before we move on. Anybody listening, if you want to Google Project Drawdown or write that down and look at their solutions section, it's pretty amazing. And they look at, they're looking at a global perspective. They are looking at how to decrease greenhouse gases in terms of solutions worldwide. And the interesting point is the top two solutions are both food, plant-rich diets and decreasing food waste. So this is such an important topic. And so now we'll move from our A++ students to our rock stars of plant-rich menus and healthcare. That's the informal introduction. We have two rock stars coming up. So I'll introduce them both together right now. Marianne will be going first and then Hayley. Marianne Katusin is the Director of Support Services at Halton Healthcare. She's worked in acute healthcare setting for 30 years and brings drive, innovative thinking, and commitment to providing exemplary patient meal experiences. Marianne was the project lead for Halton Healthcare's award-winning Good For You Locally Grown project, recognized by the Greenbelt Fund for putting more Ontario grown and produced foods on hospital menus. She's also a former innovator in the Nourish program, which addresses the future of food and healthcare. Marianne is an active member of the Canadian Society of Nutrition Management and also works as a part-time instructor with CHA Learning's Food Service and Nutrition Management program. And Hayley is the co-executive director of Nourish. She is a systems thinker and facilitator who has spent a decade working with public institutions on pathways to more sustainable futures. She designed and led Nourish's 2016 to 19 National Leadership Program and previously started My Sustainable Canada's mentorship program on public procurement. Previously, Hayley has worked as a writer-broadcaster for the CBC, a backcountry canoe guide, and as a convener of farmers, processors, and public buyers across Canada. Drawing on a background in adult education and systemic design, she weaves collaborations that rebuild connections to land, health, and each other. A Franco-Ontarian settler based in Toronto, Hayley is a graduate of McGill and U of T, where she earned a Master's of Education in Leadership, Adult Education, and Community Development. Okay, so passing it to Marianne.
Great. Thank you so much, Miles. I'm really happy to be able to share the Halton Healthcare experience related to implementing plant-rich items onto our menus. And it's really great to get some of the research information from both Elísabet and Lindi, because some of our experience actually shadows everything that their research has shown. So a little bit about Halton Healthcare. So we are 3 community hospitals located in Halton Hills, Milton, and Oakville. So our 3 hospitals, Georgetown, Milton, and Oakville, are part of our Halton's rich history and have a very long-standing tradition of providing quality care to many generations of area families. Together, we serve a population of approximately 500,000 residents. Food services at Halton Healthcare does operate at all 3 of our sites. We do have various meal delivery models, including our award-winning call-to-order room service model. The Oakville Trafalgar Memorial Hospital is the largest of the 3 sites, and we operate a centralized production and procurement, very much like a commissary-style model at the Oakville site. We do ship food in bulk to our Milton and Georgetown locations 7 days a week, and that includes in-house production of several soups and entrees with local ingredients and plant-based proteins. Our distributor partner is Gordon Food Service. So transforming the patient meal experience, one step at a time. The team at Halton Healthcare has spent significant time and effort at elevating our patient meal experience through both our call to order room service model, our bedside meal selection model, and touchpoint dining models. The team has also made a very strong commitment to our award-winning Good For You Locally Grown initiative by providing nutritious, local, and homemade food items to our patients at all 3 sites. So here's basically just a list of some of the items that we currently have on our menus that would fall within the plant-based category. All of these items are currently being outsourced, just as an FYI for now, but we are going to be exploring producing some items in-house, and I will kind of go into that later into the presentation as to why we are going to be looking at that. So why did we actually undertake this initiative? So we had a true understanding that healthy, flavorful food and a positive food experience does increase and contribute to increased patient satisfaction. We know that patients value food, they want to be healthier, and want some control over their meal experience. For those of you that are part of the webinar, really understand that food is such an important thing for our patients in our hospitals, and it's the one thing that we can provide them that gives them that little bit of control. More often than not, they don't have control over their clinical outcomes, the medications they're going to take, but you know what? If we can give them that opportunity to select their meals and have a choice, it's absolutely going to contribute to an overall positive experience. So we undertook the initiative to introduce plant-based items in 2022. There was a need identified strictly for our vegetarian and vegan diets. But one of the things that we noted was that when we were dealing with supply chain issues last year due to the pandemic, these items, the plant-based items, were always available and readily available. So the team decided at that point, you know what, we need to probably do something different, and let's see whether we can try to serve some of these items on alternate diets and alternate menus. The changes to Canada's food guide also supported our initiative, and we also know that the general population is definitely more knowledgeable about plant-based items. We're very familiar with various meatless options that are available in retail, in the restaurant industry, and so forth. And serving local and plant-based options, we knew offered a fresher, healthier option that also gave patients an option to choose positive environmental and community impacts. So how did we actually introduce some of these items? We organized taste panels to review some of the new plant-based items. They needed to work with all of our meal delivery models. So at Halton Healthcare, we don't just have the room service model of delivery. We do some bulk retherming at our 2 smaller sites. We needed to make sure that these items were going to work in all of our different reheating and cooking methods. We engaged our patient family advisors as part of our menu committee, and they attended some of our taste panels to provide feedback. And I'm going to be honest, the feedback was not that great. So unless you were already exposed to, plant-based items, we had a lot of people turning their noses and, looking for the meat and potatoes kind of things. But we really asked them to be open-minded when they were, trying some of these new items. We have 3 different and diverse communities that we serve. So plant-based items were added as a choice for patients to select from. We are very much still in a meat and potatoes population, and the average age of our patients ranges from 65 to 70. It's what they're accustomed to. It's what they grew up on. So this was definitely going to be a huge change and a mind shift for them. We did get some patient feedback, which we gathered through patient satisfaction surveys when we started to introduce plant-based items to our menus, and then just some anecdotal feedback. I didn't think I would like a vegetarian chicken nugget, but it tastes good. You'd never know it wasn't meat, which was really interesting to get some of that feedback. Sorry. So some of our challenges. So because we are currently outsourcing a number of the products, so we are bringing in ready to serve items, the nutritional analysis and the ingredients are very difficult for us to work in some of our complex diets. So what we have noticed is the sodium levels are a little bit higher. The ingredients do contain some fillers and some additives, and we noticed that our allergens were definitely increasing when we were coding items into our food service management system. So there really wasn't a lot of options as well for healthcare, especially for those who are not cooking in-house. So a number of healthcare facilities do rely on ready-to-serve items. There isn't a lot of options that are going to be available for those facilities. So we also found that some of the plant-based items can be more expensive, but I truly believe that this is due to low demand. Manufacturers, there's very few manufacturers in the market, and a lot of them are not accustomed to the needs of our healthcare population. So they really don't know what types of products to produce. And the reality of it for us is that patients are still very hesitant to choose some plant-based items. So in terms of closing thoughts, as Lindi and Elizabeth both said, start small. You have to start on a small scale, engage your stakeholders. So we did engage, our clinical team, our dietitians, we engaged our patient family advisors. We got feedback from our patients. We really needed that feedback. One of the things that we do know is that hospitals do have procurement power to move this type of change forward. And we need to be able to engage our manufacturer partners to develop more items that are going to be suitable for healthcare. So clean ingredients, better nutritional analysis. And it's a great opportunity to introduce change for people that will have a lasting impact on their lifestyle and, of course, our environment. One of the things that we found was we needed to offer the patients a choice. We need to understand what the patients wanted. The change was not easy, but with every challenge, we knew that there was an opportunity. And as a final thought, it's important for us as healthcare leaders to become transformational leaders. We need to commit to being able to transfer the knowledge from our learnings and challenge the system that's out there. And I will turn it over to Hayley.
Thanks, Marianne. Oh, wow. What a lineup. Okay, I don't have to give my presentation. Such fantastic work from Lindi and Elizabeth and Marianne. Like, I can just go home because it's done. I will take a few minutes, but I actually am going to move pretty quickly through my slides because we wanted to save time for questions. And everyone has done such a wonderful job of representing this work. So I'll just say Nourish works nationally in a really kind of like peer-to-peer based mentorship approach to bringing change into your organizations, using the power of food to build health for people and planet. And when we talk about planetary health menus at Nourish, we're talking about the drawdown related interventions, the Eat Lancet validated data-backed interventions, the World Resources Institute validated studied interventions that you can take to basically reduce your organization's carbon footprint, investing at once in the health of people and planet. So when we say planetary health menus, we are really talking about that alignment, that sweet spot between this is good for people and it's good for planet. And so over the course of this next year, in the next few months, we are actually going to be launching a new program around planetary health menus that will be a way to network, connect, and support folks in the healthcare sector like yourselves, like Marianne, who are already leading the charge in this, to support the work to happen. Because as Marianne said, the need for healthcare leadership and for it to be transformational is really key. So before I start, Marianne, I was also just going to ask if I could get an order of that curried madras tofu and rice, because that sounded really good. Maybe I'll hold off for the in-house version though. No, it sounds great. It's been so exciting over the last few years to see the traction across the country that more plant-rich diets are starting to have. I had a really wonderful jerk on chicken at a training last Friday. Anyways, I was very impressed. Okay, so I think I'm supposed to advance my slides, so I'm just going to keep moving. So I think I want to point out that hospitals have an annual $4 billion opportunity for sustainability and to advance preventative health. That's what planetary health menus is all about. There are so many pain points in our healthcare system and that are connected to food. climate is an underlying factor that exacerbates so many of the other pain points within the health system. You can see the list. You know this so well from your day-to-day. Lindi and Elizabeth already shared the data. Food's impact on climate is huge. Climate change is the biggest health threat of the 21st century. The sector itself is contributing 5% globally to greenhouse gas emissions. And 1/3 of anthropogenic greenhouse gas emissions are coming from the food sector. So the choices that the healthcare sector is making about the food it puts on the plate, how it engages with supply chains, how it's managing and reducing waste, how it's designing menus are enormous. Lindi and Elizabeth already spoke to the fact that current diets versus an ideal planetary health diet, we're just kind of way out of whack, surpassing the planetary health boundaries. So much of this is stemming from the industrial production of meat and dairy, which is very different from consumption through indigenous foodways of plants and animals. So we are really interested at Nourish to figure out a way to support further leadership, like what you see from Marianne, like so many of you are already practicing at your facilities, to really go to go beyond nutrition requirements and shift to meals that reduce carbon, reduce food waste, offer culturally diverse, culturally appropriate, plant-forward, and sustainably sourced foods. And so this Planetary Health Menus approach is one that we work on through our 3 interconnected impact areas. So everything we do, we look at the connections between sustainability, equity, and community well-being. And so this forthcoming program from us is going to offer tools and supports for the Canadian healthcare sector to really support your leadership to move this work around planetary health menus forward. Many of you are familiar with our cohort-based programs where you have to apply to get in. This is not like that. This will be a set of resources, many free, some paid, that you can come and access at the website. This will be everything from tools around baselining, designing and purchasing for more sustainable menus, learning about indigenous foodways, food service innovations, behavioral insights resources that have come from international research groups around how really to advance climate leadership through food at your facilities. And then I think one of the big selling things is there will also be tools and supports around actually calculating your food-related emissions reductions. So these are things that are coming. I'm just going to drop in the chat the link on the Nourish website where you can sign up for the info for the program when it launches. And just for now, as a little teaser, as I wrap up, we are having a first webinar where we will be launching one of the first resources that we have in development around this now. There are others that already exist. Some of you will remember from the last Nourish cohort, there's a sustainable menu guide that exists. You can find that on our website. But this new tool, one of the first new offerings of the Planetary Health Menus program, is this primer around values-based procurement. So I'm sure many of you have had the experience of feeling like your personal and your organizational values don't always show up on the patient tray. A lot of this has to do with the interactions with your value chains or supply chains. How can you start to get those things represented in your agreements, and how you go to market to get your food supplier distribution needs met? This primer will take you step by step through how to take control of your purchasing, as Dan Munshaw from the City of Thunder Bay, one of our co-authors in this work, shares, and Wendy Smith, who I'm sure many of you know as well, she would talk about the idea of making public dollars work for the public good and for the patient. So stay tuned for details for that. Autumn, I think you have the details for the webinar. If you want to drop it in the chat, that will be your first opportunity to start to connect in with us and this new community of practice around planetary health menus. And the last thing I will say is we are really excited to announce that Nourish is going to be hosting its second national symposium in Saskatchewan, September 19th to 22nd. And we're going to be co-hosting with the whole Saskatchewan Health Authority and Chep Good Food, who are their partners, our partners in the Anchor Cohort program. And this will be an opportunity to come together nationally for more shared learning around planetary health menus, Indigenous foodways, and generally healthcare leadership through food. So I'm going to stop there and just thanks again, Lindy and Elizabeth and Marianne for the amazing content, and Miles and Autumn for hosting.
All right. Thank you very much, Hayley and Marianne. Excellent, excellent stuff. This is a really fast-paced webinar today. We actually only have 8 minutes left for questions. I'm going to throw this out to Autumn and Caroline. Maybe you can put it in the chat. Are we absolute hard stop at 1 o'clock, or if people want to stick around, can they stick around? Maybe you could put that in the chat. I know most people are going to have to leave at 1. I also just want to give a shout out to the other people who've been involved with our food working group. Carrie Howell, I think she's on today. Linda Barangu's on today. Wendy Smith is out of town. Steve Crawford and Russell D'Souza. If any of you are on and want to answer questions, please go ahead. I don't know if the panelists have had a chance to look at the questions. I can give sort of a quick answer to the first one. Sarah Morris asking about local food in the context of climate and GHG, and it is a shocking answer. I understand that most meals in Ontario, long-term care hospitals travel 4,500 kilometers from food to plate. I think that was a study based out of Waterloo. And so much of our food is brought in from California. You'd think it's a no-brainer, but I understand because of operating greenhouses, et cetera, that it actually might be fairly close in terms of greenhouse gas buying from California versus locally. However, my understanding is that we are doing a lot of higher tech things to decrease footprint locally, and certainly buying in the summer. And I'm going to pass that over to the others if anyone else wants to add to that.
I could touch on the second question. If it's relevant to settings beyond healthcare. That is tricky because a lot of schools and childcare settings have allergen like bans, I guess. They don't allow a lot of common allergens into their environments, and a lot of plant-based subs are sometimes common allergen based. So I think it's tricky getting those swaps in outside of healthcare, but that's the extent of my knowledge. So unless anyone wants to add to that.
I can quickly add that I'm dialing in from Iceland in a snowstorm, and everyone here wants to hear our results. So I'm not working within a healthcare organization. I think it applies to a lot of different environments and organizations, but of course has to be tailored to each organization and how they are operating. That's like how I view it.
Okay.
For the first question from Sarah, I think I would just chime in and say it's so complex. There are so many factors depending on how kind of you parse it and what values you want to bring in. It's never as simple as like local is going to be better. We know that that's not the case, but there are things related to climate, growing conditions, soil inputs. And it's part of a much bigger conversation, I think, to figure out kind of what values do you want to center and focus on. Yeah.
Autumn, were you going to add something?
No.
Okay, so Canadian Coalition for Green Healthcare is going to answer this question live. Who's that?
Oh, that's just me letting
Okay.
the participant or the registrant know that
Okay.
the
All right. That's
panelists
you.
are
That's you.
answering.
You're messing with me. That's fine. Okay.
Danica asked a question. I don't know if we have the exact answer to, but we know that healthcare globally represents 5% of emissions. The specific amount of food within that, I'm not sure. a disproportionate number of the emissions come from supply chain. So we know that food is a big part of that. Antibiotics are also an enormous part of it, which has a food related aspect as well, which is, we want to be reducing the consumption of animals raised with a non-therapeutic use of antibiotics. Do we have a specific number for just the food? I'm not sure that we do. But I'm curious, and definitely Project Drawdown has done some really impressive modeling around the potential impact of those top 2 food solutions that Miles spoke to earlier around reducing food waste and plant-rich diets. So they might have something you're looking for.
Okay, excellent. Thank you. And Marianne, you see there's a couple there for you.
I do. So one of the questions was, have we been tracking any changes on the uptake of plant-based meals since we started the initiative? And the answer is yes. So what we are seeing is that patients are choosing some of the plant-based items, more specifically the items that they're familiar with. So whether it be out in retail, so the Impossible brand, of course, it's brand familiarity as well. The other thing too that we're seeing lots of uptake on is our plant-based yogurt. So yogurt is a very popular item for us at Halton Healthcare. Lots of patients select it. We serve it as a dessert, and we are seeing a lot more people select the plant-based yogurt. We are going to be doing a comprehensive patient satisfaction survey in February because we're about 6 months into all the changes that we've made. So I'm hoping to get some really good results at that time. And then there was another question regarding vegetarian menus in our hospitals that can be offered to vegetarian with low residue diets or vegetarian with a legume allergy. Huge issue, of course, for us. We have very, very limited items right now that we have that are available, just because the base of a lot of the items are legumes, are beans. There's very few items that we do have. We are going to be exploring making some items or more items in-house, just so that we can then control some of the nutritional analysis and the ingredients in those items. That is something that we're going to be starting this year as well.
Mm-hmm.
Okay, I'm going to assume that this thing cuts off at noon, or certainly if it doesn't, that people need to leave in about a minute. So I want to say thank you to all our panelist presenters. You were amazing. And thank you to the partners and sponsors. And finally, a question that some people may want to ask: if they ask the question to their facility, and if their facility is interested in moving forward, what resource, what person should they reach out to? I think this is mainly for Hayley and Marianne. What next step can they take?
And I would say sign up for the Planetary Health Menus program so you can get connected to folks across the country who are doing this work. You can help each other solve the problems. Marianne's already, cracked a nut that you don't have to crack again. So.
Yeah, and I would absolutely agree with Hayley. It's a good way for us to be able to do that knowledge transfer and that networking, which is such a key part of the industry that we're in. I mean, more often than not, we don't want to reinvent the wheel because somebody's already done some of those pieces. But as a collaborative group, I think that, as I mentioned in my presentation, is we have that procurement power to kind of push this change forward in healthcare.
Mm-hmm.
Excellent. Thank you again, everybody. So this is the official and goodbye. And then for those who have a couple more questions, I'm going to guess that a couple of us can stay on for 10 minutes or so. So what else do we have here in the Q&A? Marianne, have you answered all your questions there?
I'm so sorry. I have to sign off because the weather is an emergency right now. But thank you.
Take care of yourself.
Bye, Elizabeth.
Bye, Elizabeth.
Work to get a good connection, but thank you so
Yeah,
much. Bye,
bye.
everyone.
Thank you, Elizabeth.
Yeah, bye-bye. Yeah.
Great work.
I think I have answered, other than
Okay, excellent. Okay, great.
somebody asked about what was the least favorite item. So one of the things for us right now is the vegetarian bean chili. And a lot of that has to do with the texture of the bean and the spice. And once again, this is an outsourced product. So this is going to be one entree that we're going to look at making in-house and perhaps preparing it a little bit differently.
Mm-hmm.
I feel like in a lot of what you're talking about how we are using potentially what you might consider food waste that you might not put into other meals can be put into soups and stews and chilies, like, you know, just as a way, like it's still good, it's still nutritious, it's still available. It might just not look as pretty. So that's a great way to utilize those materials as well.
All right, I don't see any new questions. So yeah, so I think that's it. So thank you all for your time and preparing for this. And it's been fun working with you. And we're going to keep working together.
Yeah, thank you so much
Thanks,
for everyone.
Miles.
for being
Yeah.
here.
Thank you.
Okay, take care, everybody.
Bye.